this session. And that will just take a moment. I'll be right with you. After I go through all the names, I will come back, circle back, and just make sure that everybody does indeed have permission to record. I don't want anybody to be left without that ability. Okay, I think I went through once. I'm going back through again. Would anyone like to raise their hand and let me know that they do not yet have the ability to record? Okay, just to let you know, I am recording this at this end. And so should you have a problem at your end with recording, we'll be happy to share this, this file with you. Yesterday, some of you met Deputy Director for Environmental Health, Kathleen Ho. Kathy Ho talked yesterday about these complaints of possible contaminant in water from the Navy water system. She is back today to provide an update. And also with us today is Dr. Diana Felton, F-E-L-T-O-N. Dr. Diana Felton is our state toxicologist, and she is here to answer any questions that you may have on the possible health impacts associated with petroleum products. But first and foremost, we would like to provide the opportunity for Deputy Director Ho to give us an update on the situation. So Kathy Ho, thank you very much for your time again this afternoon. I know that you've got to run off to a meeting here shortly, and our stumble out of the blocks today is cut into your time. So please, we anticipate your update. Thank you.
Thank you very much for joining us all today. I wanted to provide you all with an update on the status of Red Hill and the odors that have been complained about. So as you know, the Department of Health inspectors collected samples on Monday, Tuesday, and again are out there today. Yesterday, an inspector went out to Red Hill Elementary and detected odors coming from the tap water. She took samples and sent those samples to a laboratory at the University of Hawaii. The lab detected petroleum product, and these are preliminary results, and we're not exactly sure yet what type of petroleum it is, but those samples, but they are preliminary. To date, we've received approximately 175 complaints, and they are all from the Navy's water system. We are out collecting more samples today. I know I previously reported that we had sent our samples to a California lab, and I didn't know the name of it, so I wanted to update you with that. And the name of the lab is Eurofin, and it is located in California. And we are working with the Navy to address this issue. And upon reporting to the Navy that there was a positive hit for petroleum-like substance in the tap water at Red Hill, the Navy is going to provide the school with water. Thank you. That's all the update I have.
Kathleen, I'm just curious, how much of this substance, possible petroleum, was found in the water? Can you go more into detail?
Yeah, we can't. We can't. It's preliminary results. It was just the presence of a petroleum-like substance that was in the water. I can't. There isn't a quantifiable amount.
Is there a reason to believe other locations, homes, community centers, could also have this type of substance in their water?
You know, samples have been sent to the mainland for further detection, so we'll know that. Hopefully, the Navy has reported that we could get the results back sometime today or tomorrow, and the samples that we sent to the mainland should be back sometime later this week.
So was it only detected at the elementary school, at the Red Hill Elementary School, or were there other areas?
So I can report that the sample that we sent to the university for a university lab indicated that there was
Basically, was it right from the
there was
object to attach it to a
petroleum-like
flush
products
water
in
for
that sample.
It stunk up their home.
Rick, I think, we need you to mute there, Rick. Hi, Dara.
Kathy, I have a couple questions from Civil Beat. The Navy reports the results of Red Hill monitoring well testing to DOH, but the Board of Water Supply has said for years that the Navy and DOH don't make that data available quickly enough to actually alert them to a problem and allow them to respond quickly. So the most recent results on the DOH website are from May. Why does it take so long to share that information from the Red Hill monitoring wells?
I actually don't know when we received those samples, the results. I know that the Navy tests once every 3 months, I believe. I'm not sure. I'm not sure of the timing of when we receive the results to when it's uploaded onto the website. I just don't have the answer to that.
Kathy, go ahead.
Sorry.
Kathy, to that question, those monitoring wells around the Red Hill shaft, I mean, they were set up specifically to detect whether fuel was potentially contaminating that aquifer and potentially contaminating the Navy's water system. So what are those monitoring wells showing? What have they been showing for the past week and a half?
I have not seen the results, but I'm happy to check with my staff and get back to you.
Just to clarify, you said it was a petroleum-like substance that was detected, or was it petroleum?
It was, it has a, we are not able to detect to the minutia of what kind of substance it is, whether it's, so we only know that it has the bodies of petroleum.
This might be a question more for Diana, Dr. Felton. It's one thing is odors and taste, but can she talk to us about the relative risks of drinking petroleum? I mean, some of these, the contents are carcinogens, known carcinogens. If she could talk to us about the relative risks. Thanks.
Sure. Kathy, are you ready for me to go ahead and do that now?
Yes.
Okay.
Questions?
Hi, everybody. Nice to see you all. I've met and worked with some of you, but some of you I'm new to. Just to clarify, my name is Diana Felton. I'm an emergency physician and medical toxicologist and state toxicologist for the Department of Health. I am based in the Hazard Evaluation and Emergency Response Office. So Rick, to answer your question, I think, and to clarify a little bit of Christina's question, the term petroleum is a very broad term encompassing hydrocarbons, so chemicals that are made up of carbons and hydrogens across a wide spread. So there's many different types of hydrocarbons that make up petroleum products. And the potential toxicity of the exact petroleum constituent is going to vary depending on its chemical makeup. So Rick made the point of some are carcinogenic. That's true. Something like benzene is carcinogenic. And we, at this point, cannot make exact determinations because we don't know what the exact constituent is. So getting that information when it comes through in those samples from DOH and from the Navy will help us be able to further, describe and explain the potential health consequences. But there are a few medical impacts or health impacts that happen from petroleum products across the class. So whether it's gasoline or kerosene or jet fuel or motor oil, no matter what it might be across the class, petroleum-based hydrocarbons tend to have a set of symptoms that can happen when they are ingested. And a lot of those are what we're seeing in the calls from the residents. So the main complaints that are consistent with a hydrocarbon exposure that you would get from drinking it in the water or having it on your skin, like showering, include things like itching and irritated rash or rashes on your skin, gastrointestinal upset, nausea, vomiting, diarrhea generally tends to be fairly mild, but as we all know, those kinds of symptoms never feel good. And dizziness, headache, being a little out of it or confused can also happen with fairly high doses. So those are the main things we see across all petroleum products when ingested. Fortunately, most hydrocarbons, when they're ingested, they're not absorbed into the body. So they don't tend to cause much more severe symptoms than this from the ingestion component. One thing we do worry about is that if you inhale or aspirate some petroleum hydrocarbons, you can get a pretty significant respiratory condition called pneumonitis, which looks a lot like a pneumonia, but is not infectious. So it causes things like shortness of breath, coughing, it can cause fever, wheezing. We've not been hearing reports of those kinds of symptoms from the people experiencing the fuel smell in their drinking water. The chance of those kinds of respiratory symptoms or the aspiration or the respiratory symptoms happening from swallowing petroleum-based hydrocarbons is really dependent on the exact chemical makeup of the product. So certain hydrocarbons or petroleum constituents are going to have a much higher risk of causing the respiratory symptoms, and others have a much lower risk. So for example, if you swallow a glass of gasoline, you're going to burp a lot and you're probably going to have some diarrhea, but that's about it. But if it's lighter fluid or lamp oil, that is much more likely to cause the respiratory symptoms to be aspirated and get into the lungs and really cause more significant problems. So again, we don't know exactly what we're dealing with, so we can't say exactly what the risks are, but generally ingestion of hydrocarbon causes these symptoms that I described, but is not, depending on the constituent, is not particularly dangerous in the moment. But can be very disruptive and cause symptoms. So I don't want to minimize that at all. The other thing is that the symptoms should resolve relatively quickly upon stopping the exposure. So if you stop drinking the water that has the petroleum in it, you should start to feel better, within a few hours or pretty quick. And then the other concern people have been quite worried about is the odors, and odors themselves can be quite noxious and irritating and just, uncomfortable and cause symptoms themselves. So we really recommend people, if they have odors and any odors are persistent in their home, that they really work on ventilation. So opening doors and windows, running fans, and really trying to get rid of the odor, because the odors themselves can cause symptoms for people.
Dr. Felton, are there any chances of long-term health impacts with this kind of material in the water?
So the answer to that, we can't definitively answer that till we know exactly what the constituent is. But I think at this point, we can say it's unlikely that there'll be long-term health impacts.
So for residents who are concerned or panicking, what is your advice to them? Obviously, should they not panic? Should they panic? What should they do? Should they monitor for symptoms? How long? All those things. What should they do?
Absolutely. Great question. So number one, don't panic. That never helps. Although it's hard not to do. I completely understand that. So not to panic, don't drink the water. Have your house nicely ventilated. If the odors are strong, go outside until you can ventilate out the odors. If anyone has respiratory symptoms like shortness of breath that comes on suddenly, or coughing, wheezing that's unexplainable, that would warrant urgent medical evaluation.
I do have a question for Kathleen. Yesterday, the Navy said that they flushed their water system 3 times, I believe, asking residents to run their water for minutes. Is that enough to resolve this type of possible petroleum substance in their water?
So as I said at our press conference yesterday, we will stand by, we, the Department of Health, will stand by our recommendation. That is that if you have, if you can smell petroleum-like odors in your water, do not use it. If you can't smell it, don't use it for drinking or ingesting it. You can use it for other things. With that, I have another meeting to go to, and thank you very much.
Can I ask you one question? What's the action plan going forward now that?
I'm sorry.
What's the action plan going forward now that petroleum has been detected? What is the health department going to do besides watching the Navy, providing, allow the Navy to provide water for that school? What is the health department going to do now?
We're continuing to investigate this. We're working with, we're working with the Navy, and we will reach out to our other partners, both county and other partners, to come to some resolution. We also have a contractor on staff that we will be reaching out to see any remediation efforts.
And guys, I know you probably still have questions, and I know we could ask questions for a long time, but Deputy Director Ho does have to run. She's got a meeting in less than 2 minutes, so I've got to let her fly. Please, I would invite you to send any further questions you have my way, or to Katie Rita Chang. Send them to the Department of Health, and we will do our very best to get you those answers. Director Ho, you can run to your next meeting. Thank you very much. We appreciate it.
Thank you very much.
And Diana Felton, good medical information, good advice to residents who may be living in areas where the water is suspect. So thanks, guys. Look, it's our commitment here at the Department of Health to try to update you as often as we can when we get good information. So today we found out that a sample taken from Red Hill Elementary School did contain a petroleum product. Again, we don't know exactly what that product is, but we thought it was important information to share with you. We continue to receive complaints and inquiries from people. We continue to take samples, and we do pledge to continue to update you as best we can with the information as it comes out, because this is important information. Our job is public health, and we want to keep the lines of communication open. So thank you all for taking the time to log in, and we will do this again very soon. I do promise you that.
Brooks, is there someone else that from DOH that could talk to us about the issues of the monitoring wells around Red Hill and what's going on? If there's concerns about the aquifer, we've had a lot of questions for the past 2 days that haven't been answered, and it's raising a lot of concerns.
Yeah, I as Deputy Director Ho said, we'll check into that. I'll check into that. As you know, not my area of expertise, having been brought on to primarily deal with the pandemic, but this is an emergency situation that we want to respond quickly to. So please do send me your questions, and then we'll do our best to get you answers. So Sophie, thank you. Rick, everyone else who was in there, Max, who asked questions, thank you. It's important reporting you're doing, so we appreciate it. And that concludes today's availability. Thank you, Dr. Felton.